My name is Dirk Schemmann, Senior Consultant for Orthopedic Surgery, Head of a Department for Orthopedic Surgery in Bad Neuenahr in Germany. I'm using TraumaCad for nearly 10 years. I was starting to use it only for hip prosthesis, but as the software evolved, I was finding it useful in total knee as well. And I do use it for trauma cases as well. So I do my planning, let's say, for hip fracture, where I put in a dynamic hip screw or some gamma nail, where it really helps choosing the right implant according to angle, according to diameters, and it adds some plausibility to the surgery. So I check which screw lengths, for example, I use, and if I find during the operation a totally different screw length, I have to rethink my procedure. So this is for me, it adds to the security of the procedure, let's say. It's more the workflow is really easy and therefore quick, which is really a good thing in our case, always in a hurry, always doing, especially in TraumaCad cases, has to go really fast. If I would think about one thing, it's perhaps the automatic calibration using the king mark or the auto knee procedure, which really does the placement of all the angles and lines in a short X-ray automatically.